I'm Jaden. Jamari.
I'm Courtney, and this is Kamani.
And I'm Synenthia Crosby. And today I will be talking about dementia. Dementia is actually something that is near and dear to my heart. I've experienced dementia with 3 different family members. My paternal grandmother and my maternal grandmother, I dealt with both of them having dementia at a young age. Most recently, I dealt with my father-in-law having dementia, which all of them have succumbed to the disease. Dementia is not a specific disease, it's an overall term that describes a group of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform daily activities. Alzheimer's disease accounts for 60 to 80% of cases. Vascular dementia, which is actually dementia that occurs after a stroke, is the second most common form of dementia. Dementia is often referred to as senile dementia, and that it's a natural part of aging, which is actually not true. There are actually 7 steps of dementia. The first one is non-cognitive decline, which is actually normal functioning. The second one is age-associated dementia, age-associated memory impairment, which is forgetting where objects actually are. The third one is mild cognitive impairment, which you're actually getting lost easily. The fourth one is mild dementia, which is actually disorientation. The fifth one is moderate dementia, which patients need some assistance with their everyday, to carry out their everyday lives. The sixth one is moderate dementia, which they actually are delusional. And the last one, which is the 7th step, is severe dementia, and it's the loss of motor skills, and they progressively lose the ability to speak. Now, some of the symptoms of dementia are actually memory loss, communication and language, ability to focus and pay attention is lost, reasoning and judgment, and visual perception is lost. Now, some people ask, what can cause dementia? Dementia is actually caused by damage to brain cells, which interferes with the ability of brain cells to communicate with each other. Now, how do you diagnose this? Well, there's actually not one test that's going to determine this. The doctor actually has to carefully look at your medical history, a physical examination, lab test, your day-to-day activities, your day-to-day functions, and your behavior associated with each type of dementia. And from there, if they cannot determine it, they will actually send you to see a specialist. Now, how do you treat this? It actually depends on the cause. Now, there progressive dementia and Alzheimer's disease, there's no cure and no treatment that slows or stops the progression. Now, there is drug treatment that may temporarily improve some of your symptoms, and there are non-drug therapies that can also lighten some symptoms. Now, what is the prognosis? Well, dementia progresses rapidly for some, and for others, it takes years to advance to reach an advanced stage. The progression depends on the underlying cause. Now, also, how would you cope with this? Well, as the patient, you take care of your health, join support groups, plan for the future, and as the caregiver, attend to your own physical and mental health. Don't forget about yourself. Make sure the legal and financial issues are in order for the patient. Now, how would I prevent this? Well, you can read books, you can play a board game, take up an instrument, or even do puzzles and thinking games. Take a class, engage in physical activity, eat healthy foods, be social, don't smoke, and lower your cholesterol. And that is my speech on dementia.